Hello, everybody. My name is Melanie, and today I will be talking about over the counter drugs, or OTC drugs for short. So, what is it? Well, over the counter medicine, also known as OTC or non prescription medicine, is any medicine that you can buy without a prescription from your doctor. These can be safe and effective when used properly. OTC medication serves to relieve any aches, pains, or itchiness from issues such as migraines and allergies. When thinking of taking OTC drugs, it is important to consult your healthcare provider or pharmacist about using them to avoid any misuse. Now we'll look at the history of OTC drugs. The Rose case from 1704 established that apothecaries could prescribe and dispense medicines, which broke the monopoly of the College of Physicians, which led to the continued availability of OTC drugs in Britain until 1860. 1860 was the year when abuse drugs were designated as prescription-only drugs, as many others were still made available as over-the-counter until the 1960s, when most were made prescription-only as an attempt to improve everyone's safety and reduce the amount of drug abuse. Currently, more and more medications are becoming available as over-the-counter. These are some of the different types of the over-the-counter drugs that we have available today. You may know most of them as these are very common. We have acetaminophen, which helps reduce fevers and provides relief for mild to moderate pain. Aspirin, which helps stop the production of certain natural substances that cause fever, pain, swelling, and blood clots. Antacids, which counteract the acid in your stomach to relieve indigestion and heartburn. Decongestants help reduce the swelling of the blood vessels in your nose and help open up airways for better breathing. Antihistamines help block the effects of a substance called histamine in your body. Laxatives help you empty your bowels if you're having issues going to the restroom. And sleep aids, which help treat insomnia by making you feel drowsy and relaxed. Most of these drugs can be taken by pills, and others, such as antacids and sleep gummies, can also be taken as a gummy. Now we'll look at the signs and symptoms of some of the other over-the-counter drugs that I just discussed. Salicylates affect gastrointestinal system, blood, and ears. Some side effects of these can be irritation, bleeding, aggravates ulcers, clotting, ringing in ears or tinnitus, hearing loss, and Reyes syndrome in children. Acetaminophen affects the liver, and high acute doses or chronic exposure can cause severe damage to the liver. And ibuprofen, which affects the gastrointestinal system, the blood system, and kidneys. Side effects are less severe irritation, bleeding, aggravating ulcers, clotting, and damage in the elderly or those with existing kidney disease. Like all drugs, OTC drugs have been abused. It is important to know that the misuse of OTC drugs can cause physical and psychological dependence. OTC stimulants, such as ephedrine, can be severely toxic on their own and can be used as precursors due to the addicting and dangerous amphetamines. In most states, any cold products containing amphetamine precursors are to be kept behind the counter as a safety measure. It is not uncommon to find that individuals who regularly abuse OTC products are likely to go on and abuse prescription or illegal drugs. Individuals who abuse OTC drugs are more likely to be those who are part of the unsuspecting general public who have become dependent on self-medication. The FDA is responsible for classifying what drugs can be over the counter and which can't. The FDA has been evaluating and classifying the active ingredients in OTC drugs according to their effectiveness and safety. They have attempted to make more prescription drugs into OTC drugs as a response to the public demand for access to effective drugs for self-medication, which has led to 700 new OTC products. This policy has helped cut medical costs, such as visits to the clinic for minor ailments that can be self-medicated. One major concern is that the reclassification of prescription drugs may lead to the overuse or misuse of them. It is important to use over-the-counter drugs properly. Information about the proper use of OTC drugs is required to be on the drug label and is regulated by the FDA. Here are a couple of simple rules to follow when taking OTC drugs. Know what you are taking and the dosage required. Know the possible side effects, as it is important to know the desired and undesired effects of the drug. Make sure your self-diagnosis is accurate. Read the warnings and cautions. Do not use OTC drugs for more than a week or two. And ask your healthcare provider or pharmacist if you have any questions or concerns about over-the-counter drugs. All of this information can be found on the back of the box of any of the over-the-counter drugs. Now moving on to my personal experience. Personally, I have never abused any drugs, but I have used ibuprofen and acetaminophen for relieving pains and fevers, the common reasons you would take those. But I have seen a friend take 4 pills of ibuprofen when the recommended dosage was 2, because she thought that 2 wasn't enough to relieve her pain, so she decided to take 4. It seemed as though she became solely dependent on ibuprofen and never wanted to try anything else. She also relied a lot on melatonin gummies because she has a hard time falling asleep and has a horrible sleep schedule and takes them more often than she is supposed to. Although recently, she has come back on taking so much melatonin and is working on having a normal sleep schedule, which I think has made a good progress for her and for me being, her best friend. And seeing that she's progressing and going to a positive direction. Now moving on to the AIT. For the awareness integration theory, I chose my mom, my dad, and my body as the 3 aspects of my life that I realized needed work on. I realized that while I had a normal relationship with both of my parents, there was something missing. I realized that I felt I couldn't talk to them about everything or anything because I felt like they would just lecture me instead of listening to me. So I thought of ways that I could help fix that. I decided that the only way to do that was to sit them both down and talk to them about how I felt when I would try to communicate with them. So from now on, I will focus on having open and honest conversations with them. Now, for my body, I realized that I wasn't taking care of it like I was supposed to. I was neglecting it and I wasn't happy about it. So to work on that, I will be fixing my diet and adding more nutrients that I was lacking in hopes of leading a healthier life. Now moving on to my mission statement. This is my mission statement. Nothing is impossible. The world itself says I'm possible, by Audrey Hepburn. This tells me that everything is possible and to never think that anything is impossible, because all you need to do is to push yourself and put in that effort to get where you want to be. Nothing is given to you easily in life. You always have to put in that work, and you always have to just work for it, work and work. And I felt that this was like the answer that I needed, So that's how I'm living my life. I'm just going to keep pushing and pushing and pushing myself to get where I want to be, because I'm the only one that can get me there. Now, this is what I chose for my collage. Family is one of the most important things to me, and it is the closest thing that I hold to my heart. I want to focus on the happiness and love in my life, and I value my future career as a child life specialist, as I want to work with kids and be financially set so I can help provide for my family, and maybe if I have a family of my own in the future, to provide for them as well. And yeah, that's what I chose. And these are my references. Thank you.